From Riverside Health System, this is the Healthy You podcast, where we talk about a range of health-related topics focused on improving your physical and mental health. We chat with our providers, team members, patients, and caregivers to learn more about how to maintain a healthy lifestyle and improve overall physical and mental health. So let's dive in to learn more about becoming a healthier you. All right, I'm really excited to have Omari Peterkin join us today on the Healthy You podcast. Mr. Peterkin works at Riverside Behavioral Health Center and is a nurse practitioner. Mr. Peterkin, tell us a little bit about how you ended up in your current career as a nurse practitioner, and more specifically, supporting the behavioral health patient population.
Sure. So I've been a nurse for coming up on 8 years. Have been a nurse practitioner now for this is going on year 3.
Okay.
I've done a wide range of worked as in the nursing field in different specialties. I started out in orthopedics as well as did some behavioral health on the side. Then moved on to the ICU intensive care unit and worked in the burn trauma ICU for a couple of years. While there, I think that's when I started to kind of get a hint and idea of possibly going into the mental health field, seeing a lot of patients who were treated, for their acute injuries, illnesses, and it's almost like, you take care of them, treat them, save their lives, and it's on to the next, whatever treatment or part of their lives or care. And a lot of these patients would come in experiencing significant traumas to themselves, their family members, whether they're, whatever it may be. And I always felt like that issue was never fully addressed. So that was kind of, I think, was my first indicator of, possibly wanting to explore the mental health, behavioral health field, and what led to me to eventually transferring over to fully on being in the mental health world.
Okay. I'm a former critical care nurse myself, so my background was more ICU, CCU, MICU, and those kinds of things. So we're kindred spirits as it relates to our nursing backgrounds.
Okay.
So we're going to be talking today about addiction and substance abuse. And this subject is really near and dear to my heart. I think we all have individuals that we know or even family members that have struggled with addiction and substance abuse. So I want to talk to you a little bit today around when we hear the phrases addiction and substance abuse, what does that really mean?
So addiction and substance abuse, those two words are used, very frequently in the world today, especially in the behavioral health field, and they can kind of be intermixed among each other. Addiction is almost seen, in my eyes, almost seen as like a relapsing type of disorder. It is, and a lot of people, see it. They don't, see it as, people want to see. A lot of people see, a diagnosis,
right,
whether
right.
it be like heart failure, head injury, trauma, whatever it may be. Addiction is its own type of diagnosis and, form of, in its own way.
Right.
And it's almost like a relapsing disorder where people who, may be trying to seek out, whether it be a certain substance. It doesn't necessarily have to be a substance. People can be addicted to numerous things. You can be addicted to your food, to your phone.
Right.
So it's a constant, it's almost like a relapsing disorder of using, whether it be a certain substance, addicted to, like you said, a certain food, whatever it may be, behavior that's repetitive and repetitive and repetitive, and that can be difficult to stop, address, and even treat sometimes.
Right. Would you expand a little bit more? I hear chemical reactions and things like that. So can you talk a little bit about that as it relates to addiction?
Sure.
And even substance abuse.
Yeah. So substance abuse, addiction, people may address it as, whether they may be some form of, type of chemical imbalance. The way we see it as is, when we're treating, patients or people who may be suffering from addictions or certain level of substance abuse is, they may be, seeking, specifically in substance abuse, they may be seeking alternative gains from using a substance repetitively. So whether it be, any type of drug, illicit drug, substance, or even, substances that are over the counter medications, and using it, repetitively or for incentive or ulterior motives, as opposed to what that medication may normally be used for.
Right.
When we see that at an intense level or at a level that becomes out of control,
Right.
that's when we have concerns for addiction, substance abuse, and may consider that person for some level of treatment that may be necessary.
Okay, that's great information. What about it being hereditary, or some people being concerned that they have strong family history of this? And can you talk a little bit about that?
Yeah. So there are lots of studies and evidence that shows lots of risk factors that are evident out there, in the world, and based on studies that if direct family members, or there's a history in the family of, say, a person's parent, or, their father, mother may be abusing a certain substance, primarily one known as alcohol
Right.
abuse.
Right.
That can be, there's lots of studies that show that, it runs in the family with genetics. There is a chance of, if a child or even an adult, whatever it may be, is around that type of lifestyle, influenced by that, or seeing that, or, there is significant family history. There is a percentage chance of that offspring, that child, that family member potentially, displaying some of those symptoms or having similar abuse, risk factors.
Right. Are you seeing an increase in substance abuse and addiction currently?
Definitely. Yes.
Okay.
There's been, lots of increases. I think for sure it's become more prominent, obviously, with COVID, the coronavirus pandemic, people being in their homes, isolated, obviously, along with the numerous amounts of mental health disorders that have been almost brought to light. People are seeing people who are depressed. And I think it's a mixture of, the mental health disorders as well as the substance abuse disorders, people, resorting to substances, alcohol, drugs, marijuana, whatever it may be. Excuse me. There was definitely an increase.
Have some water.
Thank you. Definitely an increase with the coronavirus pandemic that we saw in regards to substances being used, and a necessity for more treatment.
Right. I've also heard that rural areas sometimes can be plagued with addiction and substance abuse. So to hear you kind of talk about the pandemic, which isolated us in the same ways that rural communities have less activity and are more isolated. So can you talk a little bit about that, or is there any association
I would say that
to those areas?
Yeah,
as well?
there's possibly definitely an increase in the rural areas in regards to possible substance abuse and the increased numbers of people out there that are abusing substances. Obviously we see a large population of homeless people as well. We see a mixture of people who are experimenting with different substances. Different substances are being introduced to the population. A big thing this past summer with us that we saw was a spike in substances that are being laced,
Right.
Like marijuana being laced. And we have adolescents, adults, a mixture of, populations that are coming in, and, they may be, chronic users of a certain substance, for example, marijuana, and they go to use a substance that, whether it's beknownst or unbeknownst to them, that's laced, and they have their first psychotic episode.
Right.
And that can be very scary, very intimidating, not only to the person who's using the substance, but also their family members, their loved ones, and those surrounding them.
Right. Wow. Great information. What would you, as our listeners are listening today, what would you suggest if they know someone or may be struggling with addiction or substance abuse themselves?
So it can be very first of all, it's very scary.
Right.
You know, it can be very scary. It can be very challenging, you know, for especially if it's like one of their loved ones who they care for. They are used to knowing them and possibly even seeing them in a light or a manner that they're not seeing now, you know, with them being under the influence of substances, dealing with that level of addiction. So I would say, you know, it's definitely important to have an open, what we call a therapeutic mindset, where, you know, try to remain as calm as you can with the person, as patient as you can with that person or loved one. And, you know, from your own aspect of care, I think it's important to educate yourself as much as you can on what your loved one may be going through, experiencing with their level of addiction, whether it be to alcohol, marijuana, cocaine, heroin, whatever the substance is. It's important to be open, be as therapeutic as possible, to educate yourself. And, you know, once I feel as if you have a certain level of education on whatever substance that, you know, whatever substance they're addicted to, abusing, or using, to do your best to sit down and have that open dialogue,
Right.
communication, educate them if you can, because they might be the only person that you know, they might be more comfortable listening to, you know, their loved one as opposed to, you know, a stranger, whoever it may be, and provide them and educate them on choices, options of what they can do to help them with treatment. You know, try to identify in obviously the most caring and therapeutic way, how have you noticed that, you know, these substances are possibly impacting your life? Are you seeing these major changes? And, you know, they may be unaware as, you know, what's going on, how it's affecting them, which usually can be the case with, you know, addiction and substance abuse.
Okay. If they're struggling navigating that themselves, are there resources within Riverside Behavioral Health Hospital that can help support them from an outpatient perspective or even an inpatient treatment aspect?
Yes, so we have pretty much all levels of care for the most part. From an inpatient standpoint, for those patients who may be suffering from, you know, severe or significant substance abuse, alcohol, marijuana, cocaine, heroin, whatever it may be, we do provide an inpatient detox program where they may stay there for, you know, a certain amount of days. They're provided, you know, a safe, you know, care environment where they're being checked on, you know, for their safety. We provide groups where they do a mixture of group therapy, individual therapy. They may be able to meet also with a substance abuse counselor and therapist who specialize in substance abuse treatment. We also have case managers who are present that can help coordinate those next levels and steps of care to help prioritize, okay, and we meet together as a team and decide, hey, you know, and if the patient is obviously open to it too, because they have to be on board, might this patient benefit from a long-term type of hospitalization at like a rehab, which unfortunately we don't have, but we have the connections to help get them set up.
Navigate them.
Exactly. We also have, PHP, which is like a partial hospitalization program, which I would say is like the next step down from inpatient hospitalization, where patients can come, I think it's about 5 days a week, Monday through Friday, and it's, excuse me. It's like a 6-hour program all throughout the day, where they get a lot of similar treatment, therapy, medication management. They can meet with a pharmacist, case manager, so they get a full, you know, around-the-clock treatment. And then there is our IOP, which is our intensive outpatient program, which is more suitable for, like, you know, the person who's working and, you know, they come, you know, a couple of days a week, still able to meet with the groups, counselors, therapists, case managers, get medication management. And it's, you know, overall level of care, treatment to help point them in the right direction throughout the course of their their
It
treatment.
sounds like there's a coordinated effort,
Yes.
And it's individualized and patient-centered as to which transition level would be appropriate. So that's really good that they have, those resources, because I'm sure that it's challenging, and that it may take several treatment visits. Is that correct? To really overcome, addiction and substance abuse.
Yes, usually it's takes multiple courses and treatments throughout. Like you said, each person's plan of care is individualized.
Right.
So it's assessed each time they visit, and it's reviewed with that substance abuse counselor too as well, and the treatment team, to gauge, okay, how is this patient doing in regards to their treatment and their overall hopeful level of sobriety and functioning.
Right. I would think the benefit of participating in a formalized program in a transition of care is that there can be physiological symptoms related to detoxification. Can you talk a little bit about that? Because some things, I think some people think that they can do it on their own or within their own, family space or friend support. So could you talk a little bit about the benefit of a more formalized program such as detoxification?
Sure. And, I can tag in on along the lines of, when a family member or a person who is going through, substance abuse, addiction, and even, say they want to try to detox on their own,
Right.
which can be very worrisome and even very dangerous at times. And you can tell if a person, too, is suffering from really significant substance abuse or addiction issues if they don't have that insight into saying, hey, I actually need that type of treatment,
Right.
or do or don't think that they can do it on their own,
Right.
as opposed to, coming in and getting treatment from licensed professionals. So, I apologize.
That was you answered my
I answered the
question.
question.
You answered my question.
Okay.
Great information.
Okay.
And then also I would like for you to talk a little bit about the stigma that's associated with addiction and substance abuse, and how challenging that can be and really impact someone coming forward. Due to feeling they may be judged. And so I know that there are some hotlines and some other ways that they can access information while keeping their anonymity.
Right.
Yeah.
So there are numerous hotlines, that are available, for people who are, dealing with addiction, substance abuse issues, that you can keep your, anonymous and so forth.
Right.
I feel that, stigma in general has always been around. It will always be around, just based on society in general and how people look at things, how they assess things, and are judgmental on different topics. I feel that we're starting to make a dent into stigma. I think specifically, like I like to bring up the coronavirus pandemic
Right.
and all of these, mental health outcries and outbreaks, and people around the world are are starting to have that understanding that, hey, mental health is real.
Right.
People deal with it on a daily basis, and it's okay to not be okay.
Right.
It is okay, and it's important to reach out, for that level of help. We do our best over, I believe, at Riverside Behavioral to help address and, I don't like to say the word attack, but help to decrease stigma.
Right.
Because it's there specifically in that substance abuse profile type of patient.
Right.
A lot of people, and I can, tell you, the different things that people say, in general, you'll hear those negative, derogatory words. Oh, they're just a crackhead. They're
Right.
just, an alcoholic that hurts, themselves or hurts others. They just want to do this, say that, so they can go out and, get high, get their substance and get high. And those are common, words, and that all builds into stigma right there, because it sets them aside and it makes the person who may be going through those hard times and resorting to substances feel even more alienated.
Right.
So it's important, as providers, as people, educating the public on people who are going through substance abuse are human too. Everyone has their own issues in every type of way. People may cope differently. And a lot of people who are, experiencing substance abuse, that sometimes is their way of coping with hiding whatever it is they're going through, underlying trauma, underlying abuse, underlying stressors at work, whatever it may be. It's about teaching them, educating them, and all of that combined together, I think, is going to help to overall potentially decrease that level of stigma, but most importantly, continue to provide that high level of care that's necessary for people out there who are suffering, and most importantly, those who are suffering in silence.
Right. Mm-hmm. That is so important. Don't judge, because you never know what someone has been through and why they're in that situation. I just want to thank you, and I applaud your commitment to support our community and the patients that we serve as we continue. I feel like we're in the battlefield and we're combating addiction and substance abuse. So thank you very much. So if we have someone listening who may be struggling with addiction or substance abuse, or knows someone who's struggling with that, what would you say to them as we close out this podcast?
I would say that I think it's, if you are, have a loved one out there, or if you yourself are suffering, first of all, I would like to say it's okay. And you're not going to hear this a lot from a lot of people, but it's okay, first of all, to feel the way that you are feeling. And at the same time, it's also extremely important to take those next steps, to figure out what you can do to get help, to reach out. Help is readily available. Definitely here at Riverside Behavioral, I know there's a lot of services that we can provide to people, and we provide them on a daily basis. So I would say reach out, to the help that is readily available for you, and to not feel any sense of shame about it. It actually shows and displays a sense of power more so than shame for you to be able to look yourself in the mirror, or to be able to speak to your loved one, to show your loved one that you do love and care for them by getting them that essential help that they may need.
All right. Thank you. The information has been invaluable, and I know we will reach many, and thank you again.
Awesome. Thank you for having me.
All right. Thank you for listening to this episode of Healthy You. We're so glad you were able to join us today and learn more about this topic. If you would like to explore more, go to riversideonline.com.